Thank you for taking time to learn about this very important research study by NuoTherapeutics using a new way to heal wounds with Aurix therapy.
This is a multi-center, prospective, randomized trial comparing the effectiveness of Aurix therapy to usual and customary care in all Wagner grades of diabetic foot ulcers. The term all Wagner grades means big wounds, small wounds, and everything in between.
The first step in participating in this research study is reviewing and signing this informed consent form. It is very important that you listen carefully and ask any questions you may have prior to signing the consent form. Informed consent is a process. It begins when you start viewing this consent video and continues throughout the course of the study. If you have questions while you're participating in the study, please feel free to contact either the study doctor or any of his or her study staff. Their contact information is listed on the first page of your consent form. A written copy of this consent form will be given to you to keep.
This video describes the purpose for the study procedures and the risks involved in your participation. There are risks associated with the study, although in most instances these are short-lived side effects and of a minor nature. Potential benefits expected from applying the Aurix product to your ulcer include faster healing for your ulcer. This is a research study, which means that no promises or guarantees can be made as to the results of the study. Finally, to be in the research study, you cannot participate in any other medical research at the same time.
Study purpose.
This study is being conducted to determine the safety and effectiveness of Aurix, which is a blood-derived product applied directly to your wound. The study will be conducted by the study doctor and the staff. A total of 760 patients will participate in the study, which is being conducted in the United States.
If you agree to take part in this study and you sign the consent form, your study doctor will determine if you are eligible to participate. If you meet all of the criteria for enrollment, you will be randomized to receive Aurix plus usual and customary wound care for up to 12 weeks, or just usual and customary wound care for up to 12 weeks. Usual and customary wound care is the care that you receive during a standard visit to the doctor.
Aurix is made from your own blood that is mixed with additional products that help heal your wound. Aurix has been cleared by the Food and Drug Administration, commonly known as the FDA, for the treatment of diabetic ulcers, pressure ulcers, and leg ulcers for up to 12 weeks. Use for more than 12 weeks is considered experimental. You are being invited to take part in this research study because you have a diabetic foot ulcer. If you qualify for this study and agree to take part, you will need to come back to the study doctor's office up to twice a week for the first 2 weeks, and then at least once a week for up to 10 weeks. You will receive your wound treatment and a dressing change, and we will closely follow the progress of your wound healing. If we determine that your wound has healed at a study visit within the next 12 weeks, we will confirm wound healing at a visit 2 weeks later. If you are receiving Aurix plus usual and customary care and your wound does not heal within 12 weeks, your doctor may decide to continue treatment with Aurix for up to 20 weeks.
Study procedures. You will be asked questions about your general health and well-being throughout the study. Your answers will be used to document any changes in health status or side effects you may experience. Please provide us with as much information as you can, remembering that there are no right or wrong answers.
Your study doctor will determine if you are eligible to participate in the study. You will be asked how you're feeling and if you are taking any antibiotics. You will have blood samples drawn that include checking for anemia, which is a low number of red cells, and platelet functions. Platelets help your blood to clot. If these results are not already available, up to 1 tablespoon of blood will be taken for these tests. A medical history and physical examination, which include taking your vital signs, such as blood pressure, heart rate, breathing rate, and temperature, will be completed. Information will be collected on how your wound has changed over time. It is possible that the study doctor will look at how well your blood is flowing. Your wound will be examined. This may include procedures such as cleansing and debridement, which is the removal of unhealthy tissue from the wound. Maintenance of a wound environment that is moist, meaning that your ulcer does not dry out, and determining if you have any infection in your wound. Your wound will be photographed. These photos may be used for educational or publication purposes. There will be no way for anyone viewing the photographs to identify you. However, these photographs may be used in journal articles or on websites or shown at lectures for the sole purpose of education. Your wound will be dressed, treated, and covered. Your study doctor will provide you with information to make sure you understand the procedures and what is required of you during the study.
Randomization visit.
This visit may occur on the same day as your screening visit. At this visit, you will be randomized into one of two study groups. Randomization means that you are put into a group by chance. A computer program will place you in one of the study groups. Neither you nor your study doctor can choose the group that you will be in. You will have a 50-50 chance of being in either group, similar to the flip of a coin.
You will be assigned to receive Aurix in addition to usual and customary care for your wound for up to 12 weeks, or to receive usual and customary care alone for up to 12 weeks.
The following procedures will also be completed. You'll be asked to complete a questionnaire about your health and your wound, and how your wound affects your quality of life. You will receive the wound care that you usually receive during a standard visit to your doctor. If you are assigned to the Aurix plus usual and customary care group, up to 2 tablespoons of blood will be taken so that Aurix can be prepared for your treatments. Your wound will be cleansed and then Aurix and a simple dressing will be applied.
Aurix and usual and customary care group.
During the study, you will continue to be seen by your study doctor and his or her study staff. You will be required to visit the study doctor twice a week for the first 2 weeks and at least once a week for up to 10 additional weeks. You will also receive the care that you usually receive during a standard visit to the doctor, and your wound will also be treated with Aurix. If your wound does not heal within 12 weeks, the study doctor may decide to continue treatment with Aurix until your wound heals or to a maximum of 20 weeks.
Usual and customary care group.
During the study, you will continue to be seen by the study doctor and his or her staff. You will be seen once a week for 12 weeks and receive the wound care that you usually receive during a regular visit to your doctor.
The following procedures will be done during each visit.
Examination of your wound to check for healing progress and look for any signs of infection. Your wound will be measured and photographed. Physical exam will be performed as necessary. Vital signs, blood pressure, heart rate, breathing rate, and temperature. You will be asked how you are feeling and if you are taking or have taken any antibiotics since your last visit. If you are assigned to the Aurix and usual and customary care group, up to 2 tablespoons of blood will be taken at each visit so Aurix can be prepared for your treatment. Your wound will be cleansed and then Aurix and a simple dressing will be applied. Continuation of usual and customary care. The study staff will provide you with information to make sure that you understand the procedures and what is required of you during the study. At your last study visit, you will be asked to complete a questionnaire about your health and your wound and how this affects your quality of life.
It is important that you follow the instructions given to you by your study doctor regarding your wound care. You will be asked questions during each visit to ensure that you understand what is required of you and what to report to the study doctor regarding the condition of your wound.
It is extremely important that you keep your appointments as scheduled for this study. If you think you might not be able to make the visits as described in this consent form, you should discuss this with your study doctor.
Healing confirmation visit, 2 weeks after wound closure.
Your study doctor will examine your wound to confirm that it has healed. If your wound is not healed, you will continue to follow the treatment procedures for up to 12 weeks. If you are assigned to Aurix plus customary care and your wound does not heal within 12 weeks, the study doctor may decide to continue treatment with Aurix for up to 20 weeks.
Possible participation risks.
All subjects in this study will receive usual wound care, including antibiotics if their wound becomes infected. Talk to the study doctor about the risks of usual wound care. If you are in the study group receiving Aurix, you should be aware of the possible risk from treatment. Aurix is made using thrombin, which is an enzyme in blood that facilitates blood clotting. This enzyme is derived from cows. Risk of using products which contain cow thrombin include changes to your ability to form clots in your blood and to stop bleeding. These side effects can include severe bleeding. In rare cases, the bleeding has been fatal. Blood clot formation is another possible risk. Repeated exposure to the cow thrombin is thought to slightly increase the risk for these side effects. If you are allergic to materials made from cows, you are at increased risk for allergic reactions as described above, based on antibody formation. You should not be re-exposed to any products containing thrombin once this is known.
It is not expected that Aurix would harm a fetus, so pregnant women are not excluded from this study. However, standard medical care to treat wounds may involve risks to a fetus. Talk to your study doctor if you are pregnant or think you may be pregnant. Allergic reaction risks.
As with taking any treatment, there is a risk of allergic reactions. If you have a very serious allergic reaction, you may be at risk of death. Some symptoms of allergic reactions are rash, wheezing and difficulty breathing, dizziness and fainting, swelling of the mouth, throat, or eyes, fast pulse, and sweating. Please seek treatment immediately and tell the study doctor and study staff if you have any of these symptoms or any other side effects during the study.
Unknown risks.
You might have side effects or discomforts that are not listed in this video or your form. Some side effects may not be known yet. New ones could happen to you. Tell the study doctor or study staff right away if you have any problems.
Study benefits.
You may or may not benefit from taking part in this study. Potential benefits expected from applying the Aurix product to your ulcer include a faster healing time for your ulcer and lower risks of complications. This cannot be guaranteed. Others may benefit from knowledge gained from this study.
Compensation.
There is no compensation for participating in the study.
Study costs.
Only Medicare-eligible individuals be invited to take part in this study. Aurix and all tests, procedures, and clinic visits required by the study in relation to Aurix will be billed to Medicare. Medicare pays for 80% of the costs of these items. If you do not have supplementary insurance, you will be responsible for the 20% of the costs of these items. Talk to the study doctor if you have any questions about this.
Study staff payment.
NuoTherapeutics is paying the study doctor and study staff for their work in this study.
Alternative treatments.
Any of the treatments you receive for your wound in this study may be prescribed outside of this study. Your alternative is to not take part in this study and simply receive usual wound care.
Alternative treatments for diabetic foot ulcers include
cell or tissue-derived products, which are special dressings, stimulation of the wounds with an electric current, or negative pressure wound therapy, using a pump to draw fluid from the wounds. Your study doctor will discuss the risks and benefits of these options with you.
Compensation for injury.
If you become ill or are hurt while you are in the study, get the medical care that you need right away.
All research involves a chance something bad might happen to you. This may include the risk of personal injury. In spite of all safety measures, you might develop a reaction or injury from being in this study. If such problems occur, the researcher will help you get medical care. but the study site has not set aside funds to pay you for any such reactions or injuries or for the related medical care. To help avoid injury, it is very important that you follow all study directions.
The sponsor of this study will pay for the reasonable costs of medical treatment that you may require for any illness or condition that is caused directly by Aurix and/or any study procedures. The sponsor will not pay for the treatment of any underlying disease or condition that you may have. The sponsor has no plans to pay any other costs related to the injury, such as lost wages or pain and suffering. Any costs for the medical expenses not paid by the sponsor will be billed to you or your insurance company. To pay these medical expenses, the sponsor will need to know some information about you, like your name, date of birth, and Social Security number or Medicare health insurance claim number. This is because the sponsor has to check to see if you receive Medicare, and if you do, report the payment it makes to Medicare. The sponsor will not use this information for any other purpose. You still have the right to make a claim through the legal system even if you sign this form, accept medical care, or accept payment for medical expenses.
New Findings Report.
It is possible, although unlikely, that we will discover a significant new finding during the course of this research, which might cause you to change your mind about continuing your participation in the study. We will report any of these findings to you immediately.